So heritability is, or H2, is a proportion of the variation in liability to a disease that can be attributed to genetic factors. It's calculated based on the inference of genetic factors shared between relatives. And recent advancements in genetic research have introduced the concept of single nucleotide polymorphism based heritability, so H2 SNPs, which estimates heritability using single nucleotide polymorphisms across the entire genomes of unrelated individuals. So on the figure, you can see what is a SNP, or single nucleotide polymorphisms. It's a frequent genomic variation or variant at a single base position in the DNA of the chromosome. And some SNPs in the coding regions of a gene, which is called exon, can change the amino acid sequence of a protein, while others in the coding region do not change the protein sequence. So polygenic risk scores, or PRS, are predictors of genetic susceptibility to a disease or threats. They are calculated for individuals as weighted counts of millions of variants in which the risk variance and parameters have been identified in GWAS, or genome-wide association studies. You can see on the part B of the figure what is called a Manhattan plot, with each polymorphism represented, SNP1, SNP2, SNP3. And so when you calculate PRS, you just have to sum the weighted allele counts of these SNPs associated with the trait or the disease. So the polygenic risk score is the sum of the effect size for each SNPs. So you can see on part C also that polygenic risk scores follow a normal distribution on a population level, and so the distribution of case and controls, or healthy and diseased persons, clearly overlap, and the meaningful risk prediction can be only expected for the lowest percentiles or highest percentiles, so top and bottom of the PRS distribution. Polygenic risk score in medicine can contribute to the risk assessment and outcome prediction. So in psychiatry, it can be very useful also. So I will develop just three reasons for that. Polygenic risk score can help a better understanding of the links between psychiatric disease, but also between psychiatric disease and also other non-psychiatric disease condition. We know that medical comorbidities that are non-psychiatric are very common in patients with psychiatric disease. These comorbidities might be also co-occurrences underlying a global systemic disorder which share etiologic mechanisms. So deciphering the genetic relationships between psychiatric disorder and non-psychiatric disorder and between other medical conditions can facilitate understanding of biological mechanisms and also developing novel treatment approaches. The second point is that the polygenic risk score may also help clinicians, and it's very important because we know that differentiation between anxiety, depression, bipolar disorder might be very clinically challenging, while it has important prognostic and therapeutic implications. So in a recent study, researchers show that PRS can help to precise the diagnostic. And one promising way to further extend its usability is fusion PRS with other biomarkers or markers like imagery, like inflammatory markers or voice. The third point is that polygenic risk score can also provide novel approach for treatments in psychiatric disorders. Improving response and remission rates in patients with a psychiatric disorder remains a very significant challenge, as well as predicting propensity to side effects. So matching patients to the treatment they will most likely respond is the ultimate goal in psychiatry for precision psychiatry. And currently there are no biomarkers or empirical tests to predict this response in clinical practice. But there has been evidence of a complex yet clear genetic architecture of treatment response, and PRS are involved in treatment response. So In conclusion, expectation of a polygenic risk score, what they can provide, what they cannot provide, should be considered when evaluating the utility of polygenic risk score in psychiatric, in clinical psychiatry, as well as ethical concerns related to their use. But PRS are really promising tools in clinical psychiatry and research, particularly if you combine with other risk factors or other biomarkers or clinical markers to predict different outcomes, such as physical health issues or a response to treatment in clinical populations.